Bonjour, I am Flory Doucas, co-director of the Quebec Coalition for Tobacco Control, a provincial coalition of groups operating out of Montreal, and I'm accompanied by Cynthia Callard, the executive director of Physicians for Smoke-Free Canada, and Les Hagen, who is based out of Edmonton and who's the executive director of ASH Canada. Je suis Flory Doucas, je représente la Coalition québécoise pour le contrôle du tabac et je suis accompagnée de Mme Cynthia Callard, de Médecins pour un Canada sans fumée, et de Les Hagen de ASH Canada. Nous sommes ici aujourd'hui pour demander à la nouvelle ministre de la Santé, l'honorable Marjorie Michel, de mettre en place une réglementation qui protège les jeunes contre les pratiques commerciales qui les attirent vers le marché des produits de vapotage à la nicotine, une substance qui est hautement addictive. We are here today to call on the newly appointed Health Minister, the Honourable Marjorie Michel, to deliver on regulations which will protect youth from commercial practices that trivialize the addictive nature of nicotine and lure them to the nicotine vaping market. To begin with, we're calling for the urgent finalization of the regulations first published in 2021, which restrict flavors in vaping products, calling for the regulations to be strengthened so as to prohibit all but tobacco flavors, as is the case in Finland since 2016, Lithuania since 2022, Hungary and Ukraine since 2023, the Netherlands and Slovenia since 2024, and Latvia 2025, and closer to us in the States, California, Massachusetts, New York, New Jersey, Rhode Island, and Washington, D.C. Let's be clear. We're not calling for a ban on all vaping products, but only for a ban on the flavored versions that make them interesting and highly appealing to youth. We are reiterating a call made several times these past few years. Indeed, the new government and health minister have inherited a prolonged crisis of youth vaping. Youth vaping rates remain higher now than they were prior to 2018 when Canada legalized the sale and promotion of nicotine vaping liquids. According to Health Canada's Canadian Student Alcohol and Drug Survey, which collects information on substance use every 2 years from students in grades 7 to 12 attending public schools across Canada, and which surveys close to 52,000 youth from 9 provinces in 2023-2024, 14% of students reported past 30-day use of vapes with nicotine, and these numbers have remained largely steady since 2018-2019, the variation being within the confidence interval and not statistically significant. Every month, more studies confirm that nicotine vaping products, as a result of the various additives that are added, namely to flavor them, contribute to harms. The deterioration of the devices from regular use result to toxic chemicals, exposing users to substantial cardiovascular and pulmonary health risks, as well as negative outcomes for the developing brains of youth. Also, every week, we hear heart-wrenching stories of how parents, schools, and youth themselves are struggling. Kids are simply highly addicted to nicotine vaping, often having more than 20 episodes a day. While some provinces like Quebec have limited the sale of vaping products to tobacco or plain flavorless options, these measures remain largely undermined by the legal industry in Canada, exploiting weaknesses in federal rules by, for example, shipping uncompliant products from provinces that don't have regulations to provinces that do. Some of you will likely hear Imperial Tobacco and the Canadian Vaping Association representative today and in the days to come say how responsible and compliant their companies and their members are. Please know that the Quebec Coalition has had no problems getting products shipped either from these distributors or from these companies to Quebec, and these products are uncompliant. Cynthia, je te cède la parole.
La nouvelle ministre de la Santé a hérité d'un échec politique qui nuit aux jeunes Canadiens. Canadian vaping laws are a policy failure. There's no evidence that the decision to allow these products to be sold without regulations which protect youth has produced a net public health benefit. Yes, many individuals report that they have successfully used vaping products to quit, but there's no evidence that lax regulations were behind these individual experiences. There's no evidence that these individual experiences add up to a population-level improvement. The new vaping market has not increased the number of Canadian smokers trying to quit, or the chances of quitting success at a population level. It has not made smoking rates fall more quickly. If anything, smoking rates are falling more slowly in recent years than before. Meanwhile, the harms of this policy are in plain view. Federal policy has helped the tobacco industry establish a new epidemic of nicotine addiction and helped it roll back decades of progress against the use of this industry's products. La politique fédérale a aidé l'industrie du tabac à déclencher une nouvelle épidémie de dépendance à la nicotine. These products are attractive to youth and are attracting youth. Federal law allows nicotine to be sold in ways that are clearly designed to attract youth. Fun flavors, bright colors, novelty designs, easy access. The result? As many kids start using nicotine today as did decades ago. Half of Gen Z kids have tried vaping, just as half of their Gen X parents tried cigarettes, and only slightly less than the two-thirds of their baby boomer grandparents. For every 3 kids who are lured into trying vaping, even once, one becomes a daily user, an addict. That's why tobacco companies are trying so hard to block the proposed ban on vaping flavors. These products are dangerous. Federal law allows the sale of products that face few design regulations, safety standards, emission controls, or rules on ingredients. Whether the products are sold in vape stores, in convenience stores, or online from places in different countries, they're essentially the same product. There are no safe vaping products sold in Canada. Vaping products may prove to be less harmful than cigarettes, and they may not. But given that cigarettes kill 1/2 of their long-term users, that's a very low bar. As my colleague said, repeated inhalation of vaping harms the lungs and the heart. The chemicals used in the flavorings and the coolants make the products more attractive to youth and make it easier for addiction to set in. They also make the aerosols more harmful. These products harm the health of most of the users. Vaping products are not predominantly used by smokers who have switched from cigarettes to vaping. 2 in 3 Canadian vapers either still smoke or have never smoked at all, even once. In these cases, there is no harm reduction. There's only an increase in harm. Better regulations by government are needed, and they will reduce harm. Restricting the chemicals that can be used in flavorings or sweeteners, as the Canadian government proposed in 2021, will make the products less attractive and less dangerous. But other controls are also needed, such as standardized packaging and products, warnings, meaningful access restrictions, and so on. Interdire les arômes de vapotage rendra ces produits moins attrayants pour les jeunes et moins nocifs pour tous les utilisateurs. La réglementation fédérale sur le vapotage devrait adopter la même approche que celle pour les cigarettes.
Good morning. The federal government has repeatedly acknowledged the scope and scale of the youth vaping epidemic. However, the government has failed to provide youth with adequate protection from these addictive and harmful products. A Health Canada discussion paper released 6 years ago proposed 5 policy measures to reduce youth vaping. However, only one of these 5 measures, a limit on nicotine concentration levels, has been adopted by the federal government since 2019. The solution to the youth vaping problem is blatantly obvious. Canada's youth smoking rates are at an all-time low thanks to strong federal and provincial tobacco regulations. These successful policies must be applied to vaping products. In other words, the federal government needs to align federal restrictions on nicotine vaping products with those on tobacco products. Canada's medical health officers, including Dr. Teresa Tam, are urging the federal government to do just that. The measures proposed by Canada's medical health officers include bans on flavorings and sweeteners, large graphic health warnings, plain and standardized packaging and products, and controls on accessibility, including bans on interprovincial sales. These astute recommendations appear on the federal government's letterhead and website. The health minister needs to support her chief medical health officer, as was the case during the COVID-19 pandemic. The minister needs to follow Dr. Tam's advice. Urgent action is desperately needed. At the current rate of onset, we predict that over 15,000 school children will start vaping during the minister's first 100 days in office. We will be providing regular updates on this number in the months ahead. The minister needs to act before the start of the new school year in September. Schools are the epicenter of the youth vaping epidemic, and they desperately need the minister's help. Tobacco and nicotine companies are driving the youth vaping epidemic, and they can't be trusted. Canada's three largest tobacco companies recently conceded to a $32 billion penalty to provincial governments for decades of deceptive marketing behavior. Despite this penalty, it's still business as usual for the industry. What does business as usual look like? Here are some excerpts from the provincial government's statements of claim against these companies. Deliberately designing tobacco products to be highly addictive, failing to warn about the harm associated with exposure to tobacco products, targeting youth and adolescents with these misrepresentations and deceptions, knowing their particular vulnerabilities. The new government has pledged to make Canada strong and to protect and preserve our quality of life and healthcare system. There are over 90 references to health in the Canada Strong election platform. The youth vaping epidemic is undermining this objective by creating a generation of nicotine users who will suffer the consequences in years ahead. A strong Canada is a tobacco and nicotine-free Canada. We urge the minister and her government to make Canada stronger by protecting youth from tobacco and nicotine products. Canadian kids deserve first-class protection from these addictive and harmful products.
The last government caved to pressure from the industry, with a series of addiction ministers saying at one time they were favorable to the restrictions, but then parroting industry rhetoric and front group arguments, most recently those stoking fears of contraband. The most vocal groups against comprehensive restrictions on flavors are industry or have close ties to industry, with spokespersons being manufacturers, vape shop owners, or vaping product distributors. We call on the Honourable Minister Jean to deliver on the restrictions within the first 100 days of office, just in time for the next school year. Every day matters. Le dernier gouvernement a cédé à la pression de l'industrie et de ses groupes façades, lui permettant de réutiliser son propre manuel pour éviter la réglementation en utilisant des groupes façades et récemment en attisant les craintes de la contrebande. Nous appelons l'honorable ministre de la Santé à ne pas sacrifier ou à ne pas continuer de sacrifier des jeunes en facilitant leur recrutement vers la dépendance à la nicotine. This has dragged on long enough. The new health minister should not sacrifice young people to nicotine addiction in the name of smoking cessation by facilitating the recruitment of young people through marketing of frosted berries and minted lemonade vaping products, just to name a few. Thank you. We welcome any questions.
We don't have any question at the moment. Nous n'avons pas de questions pour le moment. This will conclude the press conference.
Merci.
Thank you.